Warm welcome to you from Geneva, Switzerland. I'm Reda Sadki. I'm here with Charlotte and Boo, and of course with our subject matter expert and the lead for this course, Anna Minta from the World Health Organization. This is session 5. This entire session is going to be dedicated to one thing and one thing only, and that is the presentation of your action plans. We'll get as many of you to present your initial version action plans as we can, as well as to discuss the peer review feedback if you've been able to look at it. Now, I don't know, let me just check if there are participants who are not connected to the audio. Okay, I see Machine Mohammed, obviously, okay, no, is connected, just doesn't have a webcam, so I think we're all connected. If you have bandwidth issues, you should know by now how to stop incoming video. And of course, the mechanism, I'll turn off the join and leave style now, to raise your hand. A reminder about the certification requirements. So we'll be checking on participation in the mandatory sessions, the daily reports for all the mandatory sessions. So we'll be asking you, we'll be sharing the daily report for this session at the end of, or actually after today's session. The draft action plan, which you submitted, the feedback, so the peer review to 3 of your colleagues, and then the final stage. And I really encourage you, there's always a few people who do all of the other requirements, but then for some reason believe that they're done and neglect the final stage, which is actually quite specific. So the final stage requires you to do 3 things. I'm going to go now to, actually, let me just see. Yeah. I'm going to go now to show you in Telegram is where you will find, we'll send out a proper email later. Unfortunately, 2 scholars did not follow instructions using a nickname instead of their email in peer grade. 7 scholars did not honor their commitment to peer review. Of course, we recognize that some may have entirely legitimate reasons, such as field deployment, work exigencies, but everyone is busy. Almost everyone managed to do the peer review feedback. And then we have 79 scholars who've completed all 3 peer reviews. And here are the 3 steps I was referring to. So first of all, congratulations for having made it to this stage in the course. This is not the final stage. The final stage, you need to do 3 things. First, react to your peer review feedback. So you have to actually go into peer grade and read what your peers, what your colleagues shared back with you. Second, you need to use that feedback to actually take your action plan, go back to your Word document, and make significant improvements. Once you have significantly improved your action plan, you will need to upload your final action plan to peer grade. So that will then be the final step. So congratulations to 79 scholars who've made it this far in peer grade. Remember, there are other requirements. So if you, including the 3 mandatory sessions, the daily reports, and so on. So we want you to we will be sending, of course, we'll be updating you on your certification very soon. Now, that is it for the update. So we always have a few people who miss that final stage. And we also usually have a few people who submit their initial version as their final version. So in both cases, that results in being disqualified from the course, because we do expect to see substantial and substantive improvements to your action plan. So even if all your peers thought that your action plan was excellent, we believe that there should be specific things you can improve between now and Friday, which is the submission deadline. So that is the update. I'll pause for questions. If you have a question about the process, now, if you have complaints or you're disappointed, we can address that individually if you feel something is unfair. But if you have a question about something that requires clarification, something you haven't understood, please do raise your hand but I believe the rules and the approach for this level 2 course have been clear from the outset. Overall, this is a very impressive group. Many of you are leaders in your national teams in your country for immunization, specifically for surveillance. We have seen how this translates into the kind of course we were hoping to have. So that is it for me. I don't see any hands raised or questions. So I suggest we dive right in with the presentations. Before the presentations, I would like to invite Anna Minta to share her her initial thoughts before we dive into the presentations on what her observations about the course so far as the subject matter expert and lead for this course. Anna, good morning to you.
Good morning, everyone, and good afternoon. It has really been a pleasure for me to work with you all. I've been very impressed with the quality of the action plans that I've seen so far in the sessions we've had over the past couple of days. You all have great insight into your surveillance system. I've outlined a lot of the challenges, and I've seen some creative solutions being proposed. So I'm very happy, very impressed with your work, and I look forward to hearing more from you today. I've also been impressed with your peer reviews. So I really appreciate you taking the time to read your peers' action plans and provide ideas about how to improve them. So I hope that you all are taking that information and using that to update your action plans. Thanks.
Great, thank you, Anna. And Anindya Sekar Bose has shared some very specific and detailed initial observations after reviewing some of the action plans submitted. We'll be sharing that feedback in Telegram. There's some very specific and detailed feedback that we hope you will find useful. That should be useful to many of you. So that is it for the introduction to today's session. Again, we will be spending all of the time, the full hour and 30 minutes, actually now hour and 22 minutes, listening to your presentations of your action, to the presentation of your action plans, as well as if you have looked at your peer review feedback, you can tell us already how you are going to review and revise using this peer review feedback. And then, of course, we'll have both feedback from fellow participants, from your colleagues in the course about each presentation, and then the feedback from our subject matter expert today, Anna Minta. So we now need to call on our first volunteer. If you are prepared to share your screen, what we'd like you to share is your peer grade, so you can show us the peer review feedback as well as the action plan that you submitted. If you are unable to share your screen, for example, if you're on your phone, then I'm happy to do so on your behalf. That's and then we can of course listen to your presentation. You can guide me if you want to navigate in your project. So we now need our first presenter. We have 58 exceptional scholars in the room. So please do raise your hand if you'd like to be the first to present this morning, afternoon, evening, whatever it may be for you. We appreciate for some Asian colleagues, it may be quite late in the day. So we will wait until there is a hand raised that we can go to in the room for our first presenter. And I realize stepping up can be okay. I see. Yes, Melise Teferi. All right, Melise, good morning to you.
Good morning, Rada. Good morning, Charlotte, and all the scholars.
And Melise, you are based in Ethiopia, is that correct?
Yeah.
And what time is it in East Africa right now?
In East Africa, it's 4.
All right. So let's now, yes, would you like to share your screen? If you are able to do so, otherwise I'm happy to do it on your behalf.
Okay. Can you see it?
Yes, absolutely.
Yeah, this is my action plan. Yeah. So
So we are going to set a limitation to the amount of time. So if you, let me see, so please limit your presentation to a 5-minute summary so that we can have more time for discussion and to ask you questions about what you learned from peer review as well.
okay, thank you, Reda. Thank you all to give me the chance to just present my work. This is a comprehensive VPD surveillance for effective use of resource and sustainability. This is my title actually that I'm going to just present. So the main challenge that is actually currently is the fragmented VPD surveillance system, which weakens the surveillance activities in Ethiopia. So there's actually different lines of surveillance activities for VPDs. So this different line of surveillances have used a lot of resources, human, financial, and logistic resources. So this highly distracts the VPD surveillance sustainability as well as effectiveness. So this is my great challenge as Ethiopia. Yeah. In detail, there are actually a lot of problems in workforce in different thematic areas in VPD activities. Mainly in workforce related, there is actually a training that is inception and on-job training, as well as there are some way trainings that help to improve their capacity. But there is high turnover of staffs because of low wage, and there is actually a gap in human resources because of the unsustainable funding that human resources are just leaving the organization because of their funding problems. So this is in laboratory area. There is actually the big challenge is that transportation from the sample collection to the central lab. So there is actually a gap. If there is available, there is actually travel by train, there is a travel by plane, ambulance, and normal transport even because of addressing the samples to the central laboratory for detection. So this needs a huge back-end force in the actually there is a huge quality problems because of the diligence of the samples that's collected and that cannot be early detected. And there is actually information gaps. Most commonly, information that's collected in VPD surveillance not used for evidence-based decision-making in policy development. So this is the main gap. And also the information that's collected is actually not accurate, not timely, not, it's not actually substandard and not reported as soon as for immediate actions. And when I come down to applied research, as we all know in resource limited countries, especially VPD related research are not commonly, it's not actually part of the thematic area that's most commonly addressed by research activities. So it may be a huge gap to show ways how we can address VPD, how we can just improve VPD surveillance. So this is a great limitation as a country. And the other is sustainable funding. Yeah, the funding for VPD surveillance commonly from external funders. There is no country ownership, and even there is no budget line for this VPD surveillance. Yeah, most commonly the government tries to cover the monthly salary of staffs, but other funding is commonly dependent on external funders. Yeah, when I came to my goal, actually, I'm not developed one single goal, but there's a list of objectives. So to develop a workforce appropriately trained in comprehensive surveillance, so that able to address the gaps in human resource problems. So there's actually a way that how this objective will help me to address the main challenge. Yeah, as it's stated, because of the shortage of time, it's better to just go down and try to address. So the second is to develop integrated VPD surveillance information system to support collection analysis, and this is also one important objective that I need to address, so that
so Melissa, 5 minutes is up. So please, we have not set time limits in previous sessions.
Okay.
So please conclude with a quick overview of the concrete actions to achieve your goal.
Yeah, my concrete actions are developing a comprehensive VPD surveillance strategy. Mainly, Ministry of Health, non-governmental organizations, private clinics are responsible for this, and conduct sustainable working capacity building on comprehensive VPD surveillance. It's at the national and regional level. The Ministry of Health and other governmental and private institutions will also take the responsibility. And the other is organized responsible body in the country and regional level that coordinate different sources of funding and research activities. So because there is shortage of funding for research activities, so there should be one body who takes the responsibility to coordinate funding sources, and the other strengthen quality and timely data collection and reporting, which actually similarly the national and the subnational level, Ministry of Health and non-governmental organizations as well as other stakeholders will take the responsibility, and create strong laboratory and networking to easily identify and reporting. Yeah, this is all. Thank you.
Okay, thank you, Melissa. I see, I think there are still some people who are activating their microphones, so we're going to disallow participants from turning on their own microphones. So you will therefore have to raise your hand unless you are a co-host in order to speak. So yes, let's start with, so there is one comment only from Hansa Hadoush from Africa CDC, who says, great job done, Melissa Teferi. You developed an excellent action plan. Thanks. So please, colleagues of Melissa, share your thoughts on what you just heard. Any comments? What would be your peer review feedback in addition to praise? Mersha Gorfu says, thanks so much for the wonderful works. And then let's start with Anna Minta's feedback. What would be your advice? And then Melissa will ask you what your peer reviewers said about your work. Anna?
Yes, thank you so much, Melissa, for stepping up and sharing your action plan. I'm very impressed with the strong work you've done, the great detail you've given in the action plan, and even that you selected so many objectives in the second to last part. So to start with your challenge, I thought that was well described, that the system is currently fragmented, and so it's not meeting the objectives that are outlined in the strategy. And then you gave a detailed context so we can get an understanding of how the situation is in Ethiopia. And then for the action plans, and going along too with the objectives, I know there are so many challenges that we're all facing in the surveillance system. And so it can even be overwhelming sometimes to try to think of how we can address all of them. So I appreciate that you listed several of them. One part that could be a little bit challenging then is to try to have very concrete actions for a number of them. So you can choose to focus on fewer of them, or you can sort of expand a little bit the actions that you have. And to give you a concrete example that I've seen with your colleagues as well, one of your short-term actions is to do training for the staff, which is very important, very crucial action plan. So in that case, I noticed that I think the risk to implementation part was blank, so you could expand on that. You want to do a training for the staff. What are some things that could go wrong? For example, who is going to do the training? Where are you going to get the materials from? Is someone going to ask for funding for this training? Where are you going to get the funding from? So you could think about what could go wrong and a way to make your action plan more concrete and have some more details, for example. So for example, if you're the one who's going to be doing the training, then you would request some time off to do the training. Would you be able to use some existing materials, which would be great if there's already something available in the country, which I have a feeling for Ethiopia, there are some materials already available. So this is just an example. The actions are great and they are pretty detailed, but you could add to that just to take it up another level to think about any risks to the implementation and plan for them ahead of time. So let's say next week you could go to your boss and say, this is the action I want to do, and the next month is have this training. This is exactly how I'm going to do it and who I need to help, what I need, the resources that I need. And then with those detailed plans, maybe hopefully, you'd be likely to get support to do that. So just to summarize again, it's very well done. I'm very impressed. And I think just with a few little tweaks, you can take it to the next level. Thank you.
Thank you very much, Anna. Melissa Teferi, back to you, because I want to ask you now if you have looked at the feedback you received at midnight last night from your peer reviewers. So if you haven't, you can say so, but you have until Friday, of course, to not only look at their feedback, but use the feedback, use everything you learned from the course to significantly improve your action plan and submit it by the Friday deadline. So have you had a chance to look at the feedback you received?
Yes, Radha. I have reviewed the response, the comments from the two reviewers. I found both of are really supportive and try to show different ways that I can improve my action plan. And I was actually impressed, and I'm happy to get such reviewers that maybe that help me to improve my action plan further. I'm really happy by the reviewers. I'm just interested to even read so many times. It is really supportive. It's really just a positive feedback that to improve the action plan further. Yeah, I reviewed.
And Melissa, can you give us an example of a specific piece of feedback that you are going to use to improve your plan? I'm sharing on screen here the feedback you received from reviewer 1. I'm quickly scanning through it, but is there something that sticks out that you can share with us where you said, aha, this is going to help me improve my plan?
I don't know which one, but one of the reviewers just recommend me to go detail to the laboratory related situational analysis. and try to just see my action plan as per the situation that what currently available. He informed me to, he recommended me to discuss detail the laboratory part and develop my action plan accordingly.
Okay, thank you, Melissa. Yeah. All right. Okay, thank you very much, and thank you for being our first presenter. It always takes a special kind of courage to be the first one to step up. As I've said, we're spending this entire session really dedicating it to the presentation of your action plan, so we can see firsthand what is it that you have been doing. Now, we have not done this in previous sessions. But I am setting a 5-minute timer that you can see in my webcam window. That means for our presenters, you probably do not want to try to read through your plan. Your goal should be to synthetically summarize what your plan is about, you know, what is the situation, what you're going to do about it, what are the actions in a synthetic way. So we have not practiced this in the past, so I realize, but you will be able to see the timer on my screen. As you can see, I'm just using a YouTube timer that ends with a loud buzzer at the end. So thank you, Melissa. We now need our second presenter for this session. I take note of the feedback from Jahangir from WHO Bangladesh, who thanks reviewers, says the feedbacks are well noted, accumulated, and will be incorporated into his plan. That is how I want to improve my product. And Samuel Gia has some feedback for you, Melissa. Great job. The challenge is clearly stated. You're very familiar with the local environment. I suggest you group the action plans into short, medium, and long term. It will be energy saving and prudent resource management. A total overhaul of the system is possible, but it has to be done gradually. Well done. Great. So now we need our next presenter. So let me see if I can, so please raise your hand. We have had to deactivate. There's still a few people who are activating their microphones without being requested to do so. So we now need our second presenter. So we will wait until we have a second presenter. Otherwise, we will end the session if no one else wants to present. But thankfully, Samuel Gia has stepped up to be our second presenter today.
Thank you. Good morning, everyone. Good morning, faculty. Sorry, I'm working from my mobile phone, so I will need your help to project my work plan.
All right. So let me see if I can get the timer in one screen.
All right.
And just give me a minute. I want to see if we can get the timer in one screen and the which I have actually never done before, but there's the first time for everything. So here is the timer for your reference, and then here I'm going to share my screen, and let's see if we can work through this as well. So here. Okay, that should be it. So you should be able to see the timer in my webcam window, and then you should be able to see my shared screen. Let me just go and look for your Okay, so let's go look at your initial version. Let's go look at your submission. All right, I think we should be able to look at it this way. All right, better to download it. So we'll look first at your submission as a Word document. Need a little bit more time to set this up. Okay. So your action plan is focused on organizing training and refresher training for 25 disease notification and surveillance officers, so DSNOs, in Niger state of Nigeria. So I'm now starting the 5-minute timer. The floor is yours.
Okay.
Oops.
Yeah, I'm mute. All right, thank you, everyone. I'll just have 5 minutes, so I'll quickly run through. My name is Samuel Gia. I'm a medical doctor by training. I'm the Director of Disease Control and Immunization at the sub-National region in Nigeria called Niger State. It's like a district, if you want to call that. It's like a state in the country. And we are located in this central part of Nigeria, and we are the largest state in Nigeria, about 10% of Nigeria landmass. We have a population of about 6.5 million people, about 274 subdivided wards, or maybe you can call them counties. And the challenge we have is we have challenge of human resource. Now, the government of Niger State have established a new agency, the Primary Care Development Agency, and that agency is saddled with the activities of PHC, which include immunization and also the surveillance. So now what the government proposed is that all PHC activities should be under one umbrella. And that is why staffs have been deployed from different agencies to come and to take this off, this principle of under one umbrella, under one roof. So for us, we discovered that the officers that are currently handling the disease notification and surveillance have about 18 months of service left. And so we quickly looked at the system and said, if we need, and we were not, we have issues of timeliness, completeness, data not complete. Yes, I know some are human resource related, and some are also terrain related in the sense of hard to reach settlements. We also tend to have insecurity in some areas of the state. So we came to a point that, okay, well, let us identify younger officers who are qualified and who have computer knowledge to meet the current trend of data reporting, e-data reporting, and also utilization of the various platforms. So basically, we are preparing for the future. As when I mean future, for the next 12 months, that these persons will trained and be understudying these guys. So as the older officers are exiting the system, these new officers are taking up the new role. While we're doing that, we're also identifying assistants again that will understudy these current people on the job. So we have issues around funding, also sustainable funding. But however, we have an opportunity. The opportunity we have for funding is that the government has just passed a law that 1% of the total revenue generated should be dedicated to primary care services. And so we are trying to pay advocacy to the finance, the planning commission, to the major stakeholders and also partners, so that we can harness all the resources to ensure that we can make our tools available. We can be able to transport our samples. We can also have our review meetings. We also have the challenge of data quality. So for data quality, we have trying to establish what we call a control room, where the M&Es work in collaboration with the disease surveillance officers, also check the quality of the data, to check the indices, and also to verify some of these data that are being generated. So, however, for the first thing we need to do is to organize the training. Now, I know we cannot train all the officers at once. That's why I said we need to do the training and the refresher training. We tend to have 2 trainings in a year for the DSNS officers as the need may arise. We understand there are emerging and re-emerging diseases like COVID-19 is on board. We need to continue to train them. We have now noticed that
1 minute.
All right, we noticed that there's also monkeypox all over the world. So essentially, we want to organize a 5 days training. We want to do integration and supportive supervision together with all the other officers of the districts. So instead of surveillance officer doing the work alone, they have to go with the service delivery guys, also like the immunization component, so that they're also part of the surveillance network. We're also working with also local traditional healers in case they may just see any disease and any medical condition. They can quickly take the picture and report to the nearest district. We have also, like I said, I mentioned the identification, like the advocacy should be paid to increase the budget line. For the budget line for health currently is standing at 9%, and the Abuja declaration said it should be as high as 15%. So we're also making advocacy to finance to the governor as well, so that this can be raised. Thank you very much. I think my time is up.
All right, thank you. Okay, thank you very much indeed, Samuel Gia. Let's start now with feedback from Anna Minta, and of course for colleagues, for Samuel's colleagues in the room, do use the chat and raise your hand if you'd like to share some feedback using spoken word. Anna?
Yes, thank you very much, Samuel Gia, for presenting your action plan. I appreciate the detailed background on the new way that Nigeria is implementing their primary health care. That's very helpful to know. And then also that there's this new staff that are coming in, kind of bridging with the older staff whose time is coming up for their completion. So that background is very good to set the stage for the challenge that you've described. I think it's very good how we can clearly see the flow of narrative. So your main issue is workforce that you are that you want to address. It's tied into so many other things with the sustainable financing and the lab we didn't get into, but yeah, I know you have it all there, so that's good. So, and then a few things I wanted to point out just that are in line with the strategy. So I heard you talk about integration, having the surveillance officers also with the immunization staff and the local traditional healers. So you're using the support functions of surveillance, going across support functions, including the community. Those are all key points of the strategy that you've described and will help strengthen the action plan that you have. So that's all great. It's really an excellent action plan. So I'm just thinking of a few things you could add in to maybe improve it a little bit. You could get into more about the data quality. So you mentioned that there are some challenges with data quality.
Yeah.
If you have some data, maybe on timeliness or something specifically, what is the issue with data quality? You could add in some numbers to the context. Yeah, just to give us some concrete information about that. And then in the action plan, as I mentioned with your colleague, and this is again, general feedback, is very detailed, that's great, but you could even add more detail if you want. So for the training, do you already have training materials from a previous training? Is it going to be, I'm looking at who would be involved. Okay, so different partners. So maybe is there already a training that you can pretty easily kind of put together and give to them? Or is this going to take up a large amount of time from you and your colleagues to make new materials? Do you already have a place available for the training? You mentioned that there's usually trainings every 2 years. So I'm just guessing, but you could state it clearly that there's already a location for the training. The equipment for the training is all there. It's really a matter of getting these new guys together and providing the materials, for example, or whatever it is that you need. So you could just go into a little more detail about that. But overall, really fantastic job. And like with your college, just a few little things you can do to improve. Thank you.
Thank you very much, Minta. Thank you. Well noted comment.
Thank you, Anna. I see Jahang here from WHO Bangladesh says, thank you, dear Samuel, to share your plan with us. Are there other comments, feedback before we ask Samuel about the peer review feedback that he's received from colleagues? The peer review feedback is anonymous, but perhaps if you reviewed Samuel's plan, we are, not necessarily fully anonymous at this stage with these presentations as we're reaching the end of the course. Robert Tolongwa has a comment. Thank you for your detailed action plan focused on capacity building. And Roberto has a suggestion to include assessment of training effectiveness, which will help monitor implementation of skills acquired during various trainings.
Okay,
so that's a concrete,
well noted.
Concrete suggestion. Are there other comments or suggestions? Do raise your hand if you'd like to speak. It would be lovely to hear from as many of you as we can in the next 50 minutes of this session, entirely dedicated to your project presentations. All right, so thank you once again, Samuel Gia. We now need our next volunteer. Volunteers have been slow to come to raise your hand, so please, if you are willing and able to to present your action plan, do not delay in raising your hand. We'll write down the names if we have more than one person with a raised hand. This is the point of the entire session. Of course, if there's no one willing or able to present, we can of course end this session very quickly. All right, Jamil Bao from WHO. I had not seen Jamil in the room. Let me just.
Yes, hello, can you hear me?
Yes, loud and clear.
Yeah, so I had a comment for Samuel. It was a very good presentation and you really thought through. And I was thinking that you mentioned about integrating with the EPI program and offering training to the EPI personnel as well. And I was thinking that maybe the training itself, the topics of the training could also be integrated. So use the opportunity of people gathering together to not just cover surveillance, but also to cover some of the weak elements of the EPI program, or to reinforce some of the weaknesses that were found during some of the supervisory visits, to also think about integrating training topics as well. And same for supervision, when supervision happens, to actually integrate EPI program related issues with surveillance, so that the training and the supervision is more comprehensive. Thank you very much.
Thank you, Jamil. Yes, Anna points out that Samuel was supposed to go over peer review too. Absolutely, apologies for that, Samuel. Have you been able to look at your peer review feedback? And if so, what have you gleaned? What have you made of the peer review feedback that you received?
Yeah, I was very glad when I received my peer review, and the colleagues were very, very generous with their comments, and the commendations were very, very heartwarming. I read them last night at around 11 p.m. And but one thing that really attracted is so the last speaker had already hit the nail, because one of the reviewers told me that there's a need for us to not do like one-off training. If we want to integrate services, we should incorporate the different topics, and also, just like she said, identify the weaknesses so that we can move together like a team. So that was very, very catching for me, because that suits my context here, because now we're trying to make sure that service delivery in primary care in Nigeria is integrated. Maternal and child health are also integrated, so that as the woman, as a mother is taking intervention, the baby is also getting intervention as well, and we can improve those indices together alongside, instead of getting different resources for the mother and different resources for the child. So I think that was very heartwarming for me. Thank you very much for those feedbacks, all my peer reviewers. I appreciate it.
Thank you, Samuel. And it looks, unfortunately, Samuel, like you have received only one review, unless I'm mistaken. And that is because there were 7 scholars who failed to honor their commitment to support their colleagues. And that has left 18 colleagues at risk of not being able to complete the course due to lack of feedback. So my recommendation for Samuel is to use that one piece of feedback and to do the best job that you can to improve your work. using that feedback, but also using everything else you gain from the course in order to submit a revised and improved version, even if you did not receive all of the feedback that you were hoping for. Mohammed Imran Qureshi has his hand raised, so we're looking for comments specifically on the peer review process, but on Samuel G.'s presentation. Imran?
Thank you very much, Reda. First of all, I really want to acknowledge and appreciate this excellent course designed by the Geneva Learning Foundation. And at the same time, also really thankful to the headquarter colleagues who are like chipping in, providing the excellent technical inputs and insights. And definitely this will help the overall VPD surveillance in the country, in Pakistan in general, and in the world as a whole. So I would request Reda, if you could share my creator project, because I'm unable to do that. I'm using mobile and I'm on the way.
All right, Imran, I hope your connectivity has improved since last time. I know you were in a remote area or in an area with very poor connectivity. Do you anticipate any problems with connectivity for your presentation?
No, Reda, I have stopped and I'm ready to present. No worries.
Okay.
You can share the screen on my behalf.
Yep, so I'm downloading your submission now. So we'll first share the Word document, and this time I promise not to forget to ask you about the peer review and what you learned from peer review feedback. Have you been able to look at peer review feedback already?
Yeah, thank you, Reda. I have just gone through the constructive review, which was done by the reviewers. And I'm really very thankful that all the 3 reviews were very quality reviews. And the colleagues have put a lot of time to improve this review process.
Okay.
So,
So Imran, you now have, you will have 5 minutes to summarize your plan. You can see the timer in my, instead of my webcam, you should see a 5-minute countdown timer. So please be synthetic in your presentation. And then we'll move to the discussion with initial feedback from Anna Minta, followed by feedback from colleagues. And then we'll ask you what you learned from peer review. The floor is yours. Timer is starting now. You have 5 minutes.
Reda. So as the title suggested, I just believe in strengthening the VPD surveillance system as a whole in the province Punjab of Pakistan. It's the largest province in the country. More than 52% of the population resides in the province, and the overall country is the 5th largest populous country of the world. So I believe my role was a tactical officer. It's a regional provincial level plan. And basically what I actually the role have to play is provide the
Imran, at least I'm no longer able to hear you. I don't know if Anna or others can, or Jill can confirm. I've lost Imran.
Yes, I've lost him too.
Okay. So he probably doesn't realize it. Let me just, we lost you. Okay, and he's gone. Okay, yeah, I know he is, he has been, usually has an excellent connection when he is at home, but obviously this time, okay, Imran seems to be back. Imran, I'm asking you to unmute, but my sense is that, yep, his connectivity may not be sufficient. Yeah.
I'm really sorry. It wasn't a connectivity. So I'll continue with there. So actually,
Yes, please.
We got is basically the overall like reduced ownership and oversight from the government of Punjab, and in general. And I would say that although the government is there to implement the surveillance activities and the support also, but the real oversight and ownership which is really required to have a very strengthened surveillance system within the province, that is probably a missing link, and that needs to be a bit of strength. So I'll just go through very quickly about the 5 areas. So the major area related to the workforce, I tried my level best to put a very good SWOT analysis At the same time, opportunities and threats are also identified as far as strengths and weakness are concerned. So related to the workforce, the challenge we got is basically no dedicated surveillance officer at the provincial and the district level, but at the same time who are like deputed on general duty. They are there and they are providing support. We always work on them, but they are multitasking and frequent turnover. And there are basically less support as far as the logistics and mobility support is concerned. If I go to the lab section, you know, Pakistan is the fifth largest populous country and each province is a big province. So we look forward to have a national reference labs within the country, but unfortunately that is currently not available, although some efforts have already been done in this regard, and we are looking to establish one in the dedicated sub-national surveillance lab in each province, at least in 4 major provinces of the country. Coming back to the next, which is the information system. Unfortunately, there are many information systems which are being used in the province and in the country. One is IDIMS for the polio eradication. Unfortunately, country is still struggling for polio eradication. Then we also have disease surveillance system. And then we have yet another few systems, but I'm happy that right now the track is like very good, really defined now, and integrated disease surveillance and response system is being established. Moreover, EPI MIS is being established, which have a dedicated surveillance module. So related to data use, yes, we have a very useful data. And just one successful example is basically we have since 7 years, we are maintaining to have a weekly VPD surveillance update. Applied research, definitely there is a need to guide the policy makers, and we look forward to have some quality research and sustainable funding. Although the government have various funds available, but definitely there is a need to like put one dedicated head under VPD surveillance. Now I would like to go to the actions. Basically, I divided my actions into short term, medium term, and long term. And my goal is to strengthen the VPD surveillance in the province. So first of all, I have suggested that if we could have like one framework to go for the strengthening of VPD surveillance in the province by an integrated approach, where different stakeholders can sit together and can like develop a very good plan of action and present to the top leadership in the country and in the province. Then secondly, definitely we also look forward to have like capacity building is done through different levels at the provincial level, the TOTs, then the district level cascade training, and then the health facility level, the focal persons training. At the same time, logistics support and mobility support is really required, so that could be one of the activity. Then we have also proposed to have like one system approach, which would be the best system approach, and IDSR look like the solution to many of the problems. And then we also suggested to strengthen one sub-national surveillance lab for all the public health surveillance, and VPD could be part of it. Thank you very much, Reda. Over to you.
Okay, thank you very much indeed, Imran. And of course, the connectivity challenges we all face. So over to your colleagues who are invited to share their comments, feedback, suggestions, recommendations, thoughts, follow-up questions in the chat, and then as well as praise, as Dr. Asajama and Faiza Rabbani have already done. And raise your hand if you'd like to speak, to comment orally. Then we'll start with Anna Minta to kick us off and tell us what she thought of this very brief presentation of what looks like quite a comprehensive plan.
Yes, thank you so much for your detailed presentation and for going over a lot of information in a short time. I think that the challenge you identified, lack of government ownership, is clear. For the objective, can you go back to the objective, please, Reda? So the background that you provided in the context is very detailed. I like how you organized it too, actually, because then it's very clear the different sections and the opportunities and threats at the end. So that's very helpful. And then for the objective, I'm just reading here. Okay, so yeah, so you want to, you mentioned incorporating the VPD surveillance into IDSR and then having increased, looks like increased ownership from the government. So that ties back to your challenge. Okay, great. And then for the action plan, I also like how you divided into in order, you know, the short term, medium, long term. So that's easy to follow the flow there. And one question I had for you, just for more information, it might be in the context, but I know, you know, we didn't have a lot of time to go through it, is for IDSR, the type of data that's collected for the diseases that are part of IDSR, is it enough, or is it aligned with the data that you would need for the other VPD surveillance, or would you need to make some modifications to what's done in IDSR? So since that was part of the objective that you mentioned, I was just looking for a little more information, also for my understanding and for your readers who might not use IDSR, and I know it's implemented differently in different countries. So that's
Right.
one question I have for you. Please.
Thanks a lot. Responding to your question, you are right that the IDSR generally captures the very basic information and not the detailed as far as the case-based surveillance is concerned. That is a real challenge. But at the same time, we are using it as an opportunity that at least IDSR is available in the bigger hospitals at the tertiary care level, teaching and DHQs, and right at the RSC and BHU as well. So the advantage we are getting from this is basically the cases are picked up by the health facilities and they are uploaded on the system. So at least it serves us as a source of notification. From there on, the responsible person reaches to the site and tries to investigate in detail and in depth. So there is a need to have one system. Once one system would be there, we can invest on this system to have even more and more information, and we can build on the story and even try to link it with the lab as well, so that lab results are automatically uploaded on it. And then we will be linking it to the response so that it would be IDSR complete as a whole, a package. Thank you.
Okay, thank you. Yeah, so that information is very helpful. You can add that into the action plan so the readers can get a better idea of how exactly it would work. And I think that's something great to build on. A lot of countries have IDSR. So, and as you said, right now, it's not quite set up exactly for what we need for case-based surveillance, but the point of this is to think of some innovative ways to integrate the support function. So if IDSR for you is the best support function for data collection and you want to add to it, I think that's great. And it's good to hear your ideas about how it will work. So thank you for your action plan. Very well done. Good job.
Great, thank you, Anna, for this feedback. Just to highlight some of the comments in the chat, so Faiza Rabbani, who says, the challenges identified by Dr. Imran are there, and I'm glad to listen to him and his suggestions. Dr. Essa Jama says, just thank you for the detailed action plan, very comprehensive. And Kabir Yusuf says, adds, thanks for the presentation. Your context will have richer if you have followed the guidance of the rubric. So let's see, so it's hard, I cannot tell. So I do see Segni Mekonnen and Dr. Essa Jama. I'm going to ask both of you to unmute. If it is because you do want to make a comment in response to Imran's presentation, please do so. If it is because you wish to be the next presenter, let me know, and then we'll come back to you once we've heard from Imran about what he learned from peer review. First, Segni, do you have a comment in response to Imran's presentation, or do you wish to be our next presenter?
No, I want to be a next presenter.
Okay, great, Segni. So that, and then Dr. Essa Jama, do you have a comment for Imran, or do you wish to present?
Yeah.
I note the comment in the chat.
Yeah, thank you for the scholar team and Mohammed Imran, because this is such of the people we need to learn from them, because some people have been working the vaccine-preventable disease for a long time, and they were in their duties, and like Dr. Imran, with the comprehensive detailed action plan strengthening VPD surveillance system in Pakistan with Punjab region, and how he defined with action plan and short term, long term with the region and and giving ownership to the government with capacity building. And that was just a summary of giving a compliment of saying thank you for Dr. Mohammed Imran.
All right, thank you, Dr. Sajama. Now to go back to Melese's presentation. So even though Roberto Talongwa raises an issue we haven't heard about, going back to this action plan on Ethiopia, and he suggests that Ethiopia's Tigray crisis be discussed in the action plan because it constitutes, he says, a major risk. One is insecurity, and two is health funding may be decreased to support military efforts. This is a very sensitive issue. So that is from Roberto, and that refers back to Melese's action plan. All right, so let's go now to Signy Mekonnen. Actually, no, I'm forgetting again to ask Imran to present what he learned from peer review. So Imran, let me go to your, I believe, yes, I'm already in your plan. I'm going to now share. Have you been able to look at peer review? Let me make sure I can unmute. We've had to unfortunately force mute everyone because there's several of you.
As I already said, I have just gone through all the 3 peer reviews which were provided to me, and I believe they are very constructive this time, and I'm happy from all of these 3, and I'm really thankful for the quality time that they invested, and most of them, they follow the rubric, and they provided very valuable feedback. Although appreciation is right there, but at the same time, they have suggested some substantive like points there we can like work further and try to improve the action plan. Lastly, I would say that there are like a lot of suggestions and innovations which are around. If a dedicated time is provided for that reasons, we can present few innovative ideas to improve the overall VPD surveillance as a whole. Thank you very much once again.
Great. Okay, great. Thank you, Imran. And I'm just showing some of the comments here. So on your goal, yep. And then on the actions. And then credibility and feasibility. So this is just one of your reviewers. Did you in fact receive, Imran, 3 reviews? I'll have to ask him to unmute.
Yes, I received all 3, and as I said, they are very good, and I'll try to improve my final plan.
All right. Thank you very much indeed, Imran. Okay, now we can go to Signy Mekonnen. Thank you for your patience, and apologies for my own confusion about the need to hear from each person about what they've learned from peer review. A reminder, there's always a few people, it happens nearly every time, who somehow get to this stage and then they forget about the final requirements of the course. And because of that, for that reason, they're disqualified from certification. And the final 3 steps we shared in Telegram this morning, you now need to react to your peer review feedback. So that means reading and sharing your feedback about what your peers told you, and submitting that feedback. So you have to scroll all the way to the bottom of each feedback. Second, you don't just read and say, oh, okay, that was interesting. You actually have to take your action plan and make significant, substantive, and substantial improvements to it. So even if all 3 of your reviewers said, this is an excellent action plan, you still need to revise it and improve it. There are always improvements that are possible. And then finally, you need to upload your final action plan to PeerGrade. You'll see you saw from the beginning, there were 2 slots to submit action plans. So you use slot number 1 to submit your initial version, and you need to upload your final action plan by Friday. Friday is the deadline. Again, in a level 2 course, there are no extensions. So if you missed the deadline, or if you got the time wrong because midnight in Geneva, you thought it was midnight in Abuja, it is not. And it is your responsibility to figure out what time it is in Abuja when it is midnight in Geneva, just to use one specific city as an example. So Signy Mekonnen, are you able to present, or would you like me to share share my screen.
Okay.
Are you able to share your screen, Segni? Yes. Okay, wonderful. And then you will see, you should be able to see the 5-minute timer. So the floor is yours.
Okay.
You have 5 minutes to present.
I will try to finish in 5 minutes. Okay, thank you. Thank you, scholar teams and my colleagues. Here, high turnover of staff and the absence of regular training is my titles. So accordingly, here, my country focus is Ethiopia. My location is Asosa, Benishangul Gumuz Regional State. My role or function is so as to VPD surveillance. My level is surveillance, VPD surveillance and response coordinator so far, and I'm currently assigned as BGFO manager. So in relation to my work, I'm investigators of VPD response and outbreaks, as well as the coordinators. So my VPD surveillance challenge, as you have seen in my screen, is high turnover of staffs and the absence of regular training in the contexts that I have told in Benishangul Gumuz Regional State. Next slide. Hello.
Yes. Segni, what is the
next? So here, as you have seen in here, the surveillance context in our region is almost not in a good. It is difficult to say in a good manner. Here and there, in all manner, there are many VPD is one of parasites area which needs a clear surveillance system and response. When it nowadays in our regions, indicator-based performance of VPD is so much poor. Such as proportions of district reporting at least one suspected case is below 50, which show a number of silent districts or very high, which means non-polio AFP, non-measles, febrile rash rate, and the other indicator are less than standards due to the high turnover of experienced and trained staff, lack of motivation to collect and transport sample to the nationals, inadequate payment, and so on is the challenges when we come to the workforce of our regions. Almost more than 172 staffs were recruited or deployed up to from the subnational to the facility basis. Though throughout the year there is high turnover of health workforce, mainly due to leadership interests and the staff retention in order to reach area or conflict area where still major challenges, even though this area is a reservoir of VPDs. Again, when we come to laboratory, laboratory is a fundamental structure in health system to indicate quality of VPD surveillance. But in our context, is the regional laboratory only perform the COVID-19 through PCRs. So all others VPD case samples and sample collected were transported to the national INRI EPHI institutes in order to detect the virus or confirm the disease. Another issue is information system. So in our regions, we do have a FM database that we use in order to report and detect outbreaks, which is called FM database nationally. So we try to send those regional database to the national or week-based as well as immediate basis. And the analysis was done in multi-purpose in identifying outbreak, looking at threshold of the disease, monitoring of performance of surveillance qualities were already the activities. When we come to my goal, by saying this narrative things, minimizing high turnover of health workforce and the staff retention is my the first goal, and there's another one is strengthening community engagement and vaccine preventability. So finally, I wanted to achieve this goals in order by acting the ongoing 5 action plans which we are able to achieve in order the above aforementioned goal. So the first action one is building capacity through in-service training on VPD, in cross-manner training, not only training. So using cross-training, we are able to minimize the high turnover of health force as well as staff retention. The another one is considering incentive for health workforce, which may be danger payment, or those who are working at security area or conflict areas as well as hardware areas. The another one is leadership and the partnership for their engagement on VPD, particularly as I have said earlier, shifting of staff from those who are bestly appropriately trained on VPD positions were shifted due to leadership. So we are planned to advocate them for their high engagement. The another one is community ownership and the surveillance through community and event-based surveillance. Last one is conduct regular and scheduled supportive supervision will be done in order to achieve the aforementioned the goal. So here are under accordingly summary of actions were detailedly described here. A level of implementation as well, people and the resource and the outcome and the risk to be successful. Those implementations were already done here. So we would like to thank our partners in order to act on the challenges in order to achieve the aforementioned goals. Here is all about my presentations. Thank you, Radha and all scholarship and my colleagues.
Thank you, Signy Mekonnen. So please, for colleagues in the room, as for Signy's colleagues, please share your feedback, your thoughts on this, what you heard about in this overview of his action plan. And we'll go for initial feedback from Anna Minta, and I promise I won't forget, we'll ask Signy if, Signy, have you been able to look at the peer review feedback that you received?
Yes.
Okay.
Yes, I and provide feedback. There are some comments to be corrected, but I already provide a feedback. Particularly, training is not only option in order to minimize high turnover. So is that to use a website kind of training as my colleagues provide a comment. So here I'm not only putting the training, so I'm training cross training, which means here and there should be trained and skilled person at the district, provincial, and the subnational. Because if it's my shifting, it is better to replace.
Signy, you are having some kind of problem with your microphone, so we had trouble hearing you. Let's go to Anna Minta, and then we'll ask you later about your peer review feedback. I see one particular kind of problem with one of the reviews that you received, so I'll have a comment to make about that. But let's first go to Anna for her initial thoughts and response to your presentation.
Yes, thank you, Signy, very much for presenting your action plan. It's very detailed in the context, which is good to provide background for the objective and the challenge and the actions that you described. So that is very helpful. I think high turnover of staff and absence of regular trainings is a huge problem. I am glad that you chose to focus on that. And I had a few questions for you. So you mentioned in the context that the supportive supervision normally happens twice a year. And then you had some actions related to the supportive supervision. But my question was, if you can kind of loop back to the challenge that you mentioned. So is the problem that you think there need to be more supportive supervisory visits, or that the quality of the visits needs to be adapted? I wasn't clear on exactly which part you wanted to address. So that was one. And then for the turnover due to conflict, and then it looked like government support, also a huge issue very challenging to address. And I noticed in your action plan, you'd mentioned providing some incentives to the staff. And I was wondering if you could maybe go into more details about what you think can be done. It's challenging for anyone to work in a conflict situation. So what do you think can be done? Do you think the incentives will be enough? Do you think there could be something like rotation of the staff through those areas? So there's a pool of staff and they know they would only have to be there for some certain amount of time, which might make it more bearable perhaps. So that's something I'd like some more information. And then for the plan about the in-service training, I was curious, as Jamil had mentioned earlier, who exactly would be included in that training? Is it mainly the surveillance staff, or would it also include, would it be a combined training with the immunization and the lab staff? So those are a few things, if you could provide some more detail, that would improve the action plan. Overall, very well done. You've picked a very challenging topic to address, so I commend you for making actions related to that. So thank you very much for your hard work.
Yes, Cindy, please, you may be speaking too close into your microphone. There's definitely a problem with feedback or with the loudness of your microphone. So please try to fix that so that we can actually hear you.
Okay. Here first of all, I thank Dr. Anna. Here, I think he raised two concepts, particularly in supervision aspects. Here, as I said in my VPD context, though supervision was done in fragmented manner, it is not adequate in order to capacitate those who are working at the lower level in order to detect as well as notify the VPD in the local or whatever. So in a scheduled manner as well as standardized, using a standardized checklist manner, if there is continuous in the regular and the scheduled manner of provisions of supportive supervision, there may be capacity building up at lower level. So here under, this is why I am saying scheduled as well as in regular manner. So before there is fragmented ways, which is unscheduled ways of supervision was done, that is inadequate in the non-fruitful. It is easy to say non-fruit or non-fruitless is defined. So by regular, by standardized checklists, we try to provide supportive supervisions or conduct supportive supervision in lower aspects in order to improve VPD notification and detection. The second one is the training issue. I think here, while I am saying cross training, those who are concerned body, particular to VPD, for instance, EPI officer is the one who is concerned vaccine preventable disease. The another one is those who are working at VPD or vaccine preventable disease, particularly in our context, is public health emergency management officers at district level as well as provincial as well as subnational. So being we are training only 1% or 10 officers or VPD officer at district or provincial or subnational levels, it is better to train more than 3 or more than 2 staffs at those districts, at those professionals, at those subnationals. Because if there may be shifting, or if there may be repositioning, it is simple to replace those who are competent and the well-skilled of those staff in order to easily detect as well as easily ongoing or easily cascading the well VPD notifications and the detection. This is why we include. The another issue is I think in I can't use the rubric for miss before, so I will try to include and modify all the concepts and the feedbacks that was given in by my colleagues. So finally, I will edit it accordingly. Thank you.
Okay, thank you, Signy. Anna, any further comments on this project? I do have a comment to make about the peer reviews that I looked at, but just thought you might have something additional to say.
No, I think that's fine. Thank you.
Okay, so I have a first comment. So, and this, unfortunately, this is something that we see that occurs in peer review, and you can see here that the reviewer here has given a 4, which is great, and has said an important challenge is identified. That's great. It does not help Signy figure out how to further improve, even if it is, in this reviewer's opinion, already excellent. Your job as a reviewer was to make specific constructive suggestions. So saying nice work, or as the reviewer here has said, it is really astonishing write-up of the situational analysis, unfortunately leaves Signy in a paradoxical situation. Praise is nice to receive. It may be called for here. It may be an excellent work. I'm not able to say on the basis of a 5-minute presentation. But here, the reviewer actually has not done their job, because your job is not to give your opinion, good work or bad work. It is to actually help, no matter how good it is or how bad it is, to find specific constructive suggestions to improve. Here there is one, for example. I think the goal should be written in one sentence with one word. Going a step further to do a better job as a peer reviewer would be to make a suggestion. What would be that one sentence? And that is not helping your peer. I mean, that is helping your peer in the best way possible by giving examples, by sharing what you would do. So this is actually, for me, an interesting peer review. We're going to turn to Signy to hear what you'd like to add. What have you been able to do? What are the specific improvements you're going to carry out for the substantively improved version that you'll submit by Friday? And how have your peer reviewers' feedback been useful or not to you? Over to you.
Thank you. Thank you.
So Signy, can you give us one specific example of something that you are going to improve in the final version of your plan in response to both what you were able to do with your peer reviewers' feedback, but also Anna's very specific questions and suggestions?
Okay, finally I wanted to improve. The first one is I try to use the rubric forms. The second one is I think those action that we are going to act in order to achieve the goal mentioned was not clearly mentioned, as my colleagues say. So here I wanted to specify more in order to achieve the goals in my actions. So hopefully at the next times I will try to improve in the actions, as well as where the specification or more elaborated form of the title of my VPD challenges. Thank you.
All right, thank you very much, Signy Mekonnen. Okay, we have 7 minutes left, which unfortunately is not enough to go through to hear one final presentation. I have a suggestion for Anna, and we received early this morning some very interesting feedback that could be helpful to all of the authors of the action plans from Anindya Sekar Bose. And I was wondering, would it be useful, Anna, to share that on screen and perhaps to ask you to summarize what are the main points from Anindya's general feedback, general but pointed comments to help potentially all learners in the course. Would that be a useful way to finish this session?
Yes, I think so.
All right,
Happy
great.
to.
So then let me share And we'll put this into a proper Word document, and we'll be sharing it on Telegram and in the Dropbox folder as usual. But here is the feedback. I hope you can see that. Let me see if I can make the text a little bigger. Oh. And I believe the first point was, again, as you said, Anna, recognizing the high quality of many of the submissions. Beyond that, what are the specific comments from India that you would like to highlight for the attention of learners who are now in the next 4 days with a Friday deadline, going to do everything they can to significantly improve the initial versions of their action plans?
Yes, so the first point I'd like to highlight is that India mentioned that in the action plan, just as has been described before, you want to use wording that you would also like to receive. So the example he gave is, if you say something like subnational level surveillance personnel lack capacity, it can sound a little bit negative. It could feel bad for the people who are at the subnational level who are just trying to do their jobs. Instead, you could turn it into a positive. So there are capacity challenges at the subnational level that can be explored and addressed. So you're saying the same thing, you're just saying it in a nicer way. The next one was about how you all can work together. So from some countries, there are several people who are in the course. And because we want this action plan to be something that you can actually implement in your country, you can come together and look at your plans, see if they're aligned, if there's information that contradicts, and you can discuss amongst yourselves kind of why that is, and maybe try to align them. But then I want to get to the next one about lack of resources. So several people have mentioned lack of resources, lack of government ownership, sustainable financing as some challenges. So in India gave some very specific suggestions for you that you can include in your action plan. Number one is that asking the Ministry of Health to insert a budget line for VPD surveillance. So we all know, as even someone mentioned today in their context, if there's no budget line for surveillance, then you're always trying to get funds from EPI budget line or from outbreak budget line or something like that. It makes it a lot more challenging. So if the government can at least put a budget line in there, and even if it has a tiny amount, that can be used as an advocacy tool for you to go to donors and say, look, our government is interested in surveillance. They find it so important. They've put a budget line in there, and then that can help with advocacy. He has some other suggestions in there, but I'll go down to the integration of surveillance support functions. So several of you have mentioned today, and we've seen it in several of the reports, that EPI, surveillance, and lab kind of are working in silos. They're doing their own things, and they don't take the chance to come together to discuss. So one concrete example that you can give in your action plan is to start small. Have everybody come together, one time for 1 hour or 2 hours to look through their data and see if they match. I'm quite sure you all will not be surprised that the data doesn't match, because we see that all the time. And then everyone can talk about why it is that the data don't match and try to come together on that. And in India was saying, we can keep it simple. You can start with Excel. Everybody come with an Excel spreadsheet or your PDF of your data and start from there. And then he also mentions some other ways to synchronize the data, like have everyone have their data in a CSV. These are very specific for the surveillance side, so that even if one person is using Excel, one is using EpiInfo, one is using Stata, at least everyone can open the data in their program, and then you can discuss how to make the data align. And then one thing to highlight too has been mentioned today, combined VPD trainings. Very, very important. Several of you have mentioned, and we've heard from many of you, and we know just from your previous discussions, that training is extremely important, and you can always take the opportunity of one training. If you hear that the polio team is organizing a training, jump in there if you can and say, okay, let's add in measles and rubella, let's add in yellow fever, whatever is important, or data quality, and invite those other staff to come too. And that's much easier than trying to start a whole new training, for example. So he mentioned that. Then another one I can highlight is, let's see. Oh, this is an interesting one too. New data indicators to correct the surveillance gaps. So we have heard in several countries there are problems with insecurity or difficult to reach areas because of mountainous or across rivers or something like that. So if you know, for example, he gives also nomadic population as an example. If you know that there's 15% nomadic population in your country, you would assume they also have acute flaccid paralysis and measles cases, maybe, but you're worried that they're not getting reported. Then when you look at your data, you could say, we only saw 2% of our cases coming from this nomadic population. So there's probably an issue there, because it should at least be the same proportion of cases as their population, right? So then you would know that there's some work needs to be done to do an outreach to that population. Again, that ties in with workforce. Is it that there are no staff there who are providing data? And I see we're over time. So yeah, so you can go through those in detail, but he really had a lot of good concrete examples for you to review. Thank you.
Thank you so much, Ana Minta. So this is the final time that we are meeting as a group, and the next final stage, you still have 3 steps to go to finish the course. Step 1 is to read the feedback you have received from colleagues, and then to react. So that happens in peer grade, and you need to actually write your feedback to each of your reviewers and submit it using the green button at the bottom of the React screen for each review. Do not miss that step. It is a requirement. Second, you need to take the feedback that you received and make sense of it for yourself. Decide what changes you are going to make to improve your plan by Friday. So if you have received extensive suggestions on how you can improve, it is your responsibility to decide what exactly are you going to do that you're going to carry out that you can actually finish by Friday. So you may make decisions based on the scope of the changes and what you can realistically do in the next 72 hours. Finally, once you have substantively and substantially revised your action plan, you'll need to upload the final version to peer grade. So it is only upon completion of all 3 of these steps, assuming that you have met the other requirements, including attendance for the mandatory sessions, that you will be eligible for certification. There is also a quality review. So we do look at the plans and we do look at the peer reviews. And when we find work that is clearly not up to par, that also can result in being in disqualification from eligibility for certification. That's it. This has been indeed, and I take note of Dr. Mutahar Al-Qasimi's comment. If it has been such a fruitful training, as you say, remember, this is peer learning, so much of it is due to the level of commitment and engagement of participants. I'm glad to read that it has been beneficial in theory and practice. And Dr. Mutahar notes that for him, it was really the best virtual training he's ever attended. Thank you for that. And all right. Yes, in response to Brenda's question, so the coursework remains individual to the end of the course. So you will need to submit your individual revised action plan. There will be no group submissions in this course. However, Anna's recommendation, Anna and Inidya, so the WHO recommendation is that you discuss your plans with each other and see if you are, if you have sort of differences of perspectives on the information you present or different information. If there is conflicting information, then you can discuss among yourselves and try to make sure you are understanding the context. You should still submit your own plan. And if you do identify actions you can implement together, take this opportunity to then examine how you might be able to do that. So the peer review feedback, to answer Simi's question, As stated, since the 4th of July and repeated across many messages, there are, of course, 3 peer reviews that each of you was tasked to do. So you should receive 3 peer reviews. However, 7 scholars failed to honor their commitment, and that leaves up to 18 colleagues at risk of not being able to complete the course due to lack of feedback. So if you find yourself with less than 3 feedbacks that you have received, do the best that you can using, if it's 1 feedback, use that, but also use everything else you learned from the course. And indeed, as Anna said, we're now 5 minutes over time. I'd like to therefore close this session. We will, of course, remain available for the rest of the week with Charlotte in Telegram to respond to any queries you may have. Do not miss the deadline, which is Friday evening. There is no extension in this course for any reason. So no matter how legitimate the reason, that you will receive at best a response from us to explain that unfortunately there is no extension in this level 2 course. This has been an incredible cohort once again. Thank you. And it's been wonderful collaborating with WHO and CDC colleagues. We're wrapping up the Francophone session this afternoon, and Charlotte and I are very much looking forward to that. Thank you and goodbye. We'll now do something where we will ask you to unmute yourselves. Let me see. Here, so we can actually hear each other. And if you are able to, so for Jahangir, if you've only received 2 feedbacks, but you've done everything else, the fact that your peer reviewers did not do their jobs, or one of them did not, will not disqualify you from certification.
It's not every time I stumble up you that I want to have.
Thank you.
All right, so I'm asking everyone to unmute so we can say goodbye to each other. Even though the work is not done, the work will only be done on Friday evening.
Bye, everyone.
Thank you.
Thank you. Bye.
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 Yeah, one of you. Thank you once again. Bye.
Bye-bye. Bye-bye. Thank you.
Bye.
Bye.
Thank you.
Bye.
Bye.
Nice time.
Thank you, Reda. Thank you, Anna. Thank you, Charlotte.
Thank you, everyone.
Thank you,
Thank you,
all
Reda.
my colleagues.
Thank you so much.
Everybody. Colleagues. Thank you, Imran.
Thank you.